Today I'm here with Dr. SJ, sports doctor and head of medical currently for Brisbane Roar and assistant sports doctor for the North Queensland Cowboys. Thanks for coming in today, this morning, SJ.
Thanks for having me, Mitch.
Great. So we're going to have a bit of a chat with SJ in regarding all things sports medicine. Now, Dr. SJ, what inspired you to become a sports doctor, and what does a day-to-day, average day look like for you?
Yeah, no, great question. There's probably a few reasons why I chose the path of sports medicine. It started quite a long time ago. Dealt with a lot of personal injuries myself growing up back in school, and had a really good experience with a lot of sports doctors at the time, which I really looked up to those guys. And even in med school as well, had the luxury of exploring sports medicine as well with some pretty good sporting doctors up north where I studied. And ever since I finished med school, experiments in the sports medicine field, and gradually loved it more and more. And I think it's a great job. I get to work with a lot of athletes who look after their bodies and unfortunately undergo unfortunate injuries, and you're just kind of helping them through that process with injury management, diagnosis, recovery, etc. So it's a great field to work in. My day-to-day changes week to week, so it's a mix of working in an office, behind a desk, seeing patients, clientele. We do a lot of field work as well, so we're mostly at sporting games. We travel with teams quite a lot as well. So there's quite a lot of different things you can do as sports med. It's all about what you make of it.
What would you say is the most common injuries you see in athletes today? Yeah,
and every day you ask me, I'll probably give you something different. It really comes down to what sort of sport I'm working in, then what sort of athletes I deal with. So I might be doing rugby one weekend, and we'll see a lot of upper limb contact injuries, whether it be shoulders, hand injuries, and then the next week I'll be doing a bit of soccer, and then you'll see a lot of knees and ankles. I do a lot of endurance events as well now, so things like triathlons, marathons, and you'll see like a lot of heat injuries, people coming off bikes, all the acute traumas. So it's changes day to day, really. So there's no one answer for any particular day.
Wow. All right. So how do you feel the sports medicine field has changed over the past 10 years, or how do you feel like it's moving towards a certain direction?
Yeah, that's a great question. So I've been working in sports med for about 5-6 years now, and even in that time there's been a lot of things that have evolved, and that includes things like different treatment options, different interventional stuff which we can talk about later, even different protocols and certain sporting codes as well. So concussions being like a massive topic right now. Even every year we find that concussion protocols are currently getting updated and changing and evolving over time. So it's very dependent on which sort of sporting code that you follow. It's very country based as well, so what we practice in Australia might be different to the other side of the ocean in America and Canada and things like that. Yeah,
true. So SJ, what are your top tips for athletes to actually prevent injury?
Yeah. It's a very cliche answer, but it honestly comes down to listening to your body. I know what the athlete mentality can be like. Athletes really want to push their bodies. They want to excel on and off the sporting fields, but really listening to your body, listening to those little niggles and little injuries that come, reporting injuries as soon as you can. Unfortunately, we deal on a professional level and at an elite level. We do a lot of surveillance on injury management sort of things, so we pick up on those injuries quite well, and athletes are very good at reporting those things, and we've actually got quite a big team of staff that we work with, so not just doctors but physios, ex-phys, and then it's a team effort in diagnosing the injuries and detecting them, and then also appropriately manage them in a timely manner as well.
Fantastic. How do you make return to play decisions for athletes after an injury?
At an elite level, there's quite a few different stuff involved in making that decision. So from a medical perspective, we obviously take into consideration the type of injury, the severity of the injury, the actual athlete themselves, and even specific things like what position they play, the need for that specific athlete to return, the importance of them in that sort of team dynamic, and even things like at what point in the season that we are. So for example, if we're early in the season where round games may not matter as much versus if it's a finals round, so there are all different factors that we do take into consideration, and that decision's made not just from myself, the doctor, but then also from the physios, exercise physiologists, coaching staff. So we all sit around the table and we actually have a chat and say, hey, look, this is where the athlete is at, this is their performance according to their specific injury, and what's the utility or the need for that player to return at this stage during the season.
All right, so in the year 2025, and in the past few years in particular, we've seen a growing trend of using recovery tools such as ice baths, saunas, compression boots, massage guns. Do all these things work or have a bit of a part to play in recovery or injury prevention?
I think they do. There's some mixed evidence for all those recovery modalities, and every clinician that you talk to is going to tell you something different, but I strongly believe that regardless of what the research shows, that if it makes you feel good, if it's psychologically, it makes you feel good as well, and it puts you in a better position and mindset for recovery, I think they're very useful tools to use, but also to be used carefully as well, because sometimes they can give you a false sense of confidence and make your body feel great when it's actually not properly recovered and adequately to return to sport and exercise. Yeah,
agreed. I think, I think you would agree as well that the research does show that that proper nutrition and diet, but in particular something that's really undersold is sleep.
100%.
And regular sleep.
Yeah, exactly.
Do you have a regular sleeping pattern?
Yeah, exactly. Completely agree. It's just not just those recovery modalities that we use. It's a combination of nutrition, sleep, fueling your body, and just listening to your body as well. So if you use everything in combination, like you maximise your best possible chance of making a successful return to exercise and sport. It's
great. I feel like that is probably the best advice for athletes. Great to use all those things in injunction, but if we're not getting regular, consistent sleep and fueling the body correctly, mixed with stress, mixed with hormonal imbalances, injury can be there around the corner. So.
100% agree.
And a lot of other future technology coming out, such as, VALD, a lot of gear that we can really use precise, accurate measurements for athletes. How do you feel technology like that is changing the game?
Yeah, I think it's good numeric data to use with athletes, especially returning back to sport. I personally have used it with my own recovery programs and return to sport. So right now I'm dealing with an ACL injury and I'm about 7-8 months post-operative, and my knee feels great in the gym. I'm putting up good numbers in the gym, but as soon as I do the VALD testing, they give you different metrics and numbers that you don't even realize, things like the force generated and balance and etc. And those are things that you can't actually understand in your body. Sometimes it's good to have those numbers there and an exercise physiologist and a physio run through those numbers to see what sort of stuff that you have to work on. Otherwise, if you don't have those numbers there, it can sometimes give you a false sense of confidence that you're ready to return back to certain activity in sport when you're not to. So I think they're very handy tools to have, and used in conjunction with the right therapists such as physios and EPs, they're a very useful tool for returning back to sport and making sure you've ticked the right boxes in order to ensure a safe return. Yeah, absolutely. Shout out to our friends at VALD. They do a really fantastic job, and I feel like now they have such a humongous amount of data, pool of data, that you can get the percentiles for the age and sex as well, which is also quite handy to look at from a performance aspect. Yeah. Absolutely. How do you go about balancing that pressure of keeping athletes on the field, but also managing their long-term health? Yeah, that's tricky, and it's case by case, athlete to athlete. The answer's always going to change. If you've dealt with athletes before, like their athlete mentality is, hey, all I care about is my professional sport. I just want to get as many minutes as I can on the field and train as much as I can. And sometimes that can hurt them in the long run. So it does take a lot of careful planning and discussion with the actual athlete, and having discussions around, hey, if you've got this relevant injury, or if you're training to this extent, in the long run you can cause long-term repercussions and complications to your body, but a lot of athletes are well aware, and they do have that understanding, and they usually do want to maximize the performance within their actual sporting career. And it's a bad mentality to have in the long run, but they will often say, hey, I just want to prioritize my sport right now, and I'll deal with all that stuff in the future. And as long as you have that sort of careful discussion with them and you make a mutual agreement with them, you can't go wrong for, I guess, both parties. Absolutely. And Dr. SJ, what early warning signs do you think athletes should never ignore? I think a lot of people forget that overuse and chronic injuries make up a huge part of the sporting population as well. It's not just acute injuries that you see at those specific times. And what we do find, and this is pattern recognition, is that the overuse injuries could have been detected a lot earlier and sooner if patients reported certain symptoms or niggles or pains in their relevant bodies there. And unfortunately what we find is that with overuse injuries, the longer that they've been lurking in the background for, the harder they become to manage and the longer the recovery treatment as well. So I guess, to answer your question, like it's all about, listening to your own body, reporting those specific things, seeking early treatment and management from not just doctors, but from physios and EPs as well, in order to minimise your time away from sport and activity.
Yeah, for sure. All right, so moving on to injectable therapies. Corticosteroid injections, they get utilised a lot by sports medicine. I guess, what is the purpose of a corticosteroid injection, and who is considered a good candidate for a corticosteroid injection?
Yeah, again, it's case by case, patient to patient. So the main purpose of corticosteroid injections, it's an anti-inflammatory medication that, rather than taken as a tablet, we're injecting directly into its relevant body part. And with the anti-inflammatory properties, it can reduce certain inflammatory conditions and injuries, and also reduce pain as well, to ensure a faster return to play. So it's useful in some cases where if we think that the relevant injury is a stable injury, that it's fine to inject, but there is also certain injuries that you don't want to inject, and you want to know if it's painful, if it's inflamed, if it's angry, because pain in those situations is actually a good utility tool to use, because it can guide your recovery as well. So it takes a lot of careful planning and discussion with the athletes, and also coaching staff, performance staff as well, before we make that decision to inject or not, and we'll always ever do it in a safe manner.
For sure, absolutely. And what are your thoughts surrounding injecting tendons, and maybe some other kind of risk factors? So there's a bit of a mix of advice out there in regards to injecting tendons. Yeah,
definitely, So there's specific tendons that we will always avoid, and the main one that the literature will suggest is Achilles tendon. So we rarely inject Achilles tendons due to its risk of causing further damage. But what we're finding is that majority of other non-load bearing tendons are actually quite safe to inject, as long as you supplement it with like other forms of treatment as well, and that most includes your strength and conditioning rehab. The corticosteroid is there purely to help with the pain and also the inflammatory response following an injury, but it's still important that the tendon still needs to heal with more natural measures, and that can just be time and also the strength and conditioning as well. So I would never suggest purely just relying on just a cortisone injection and nothing else. It takes a mix of different treatments in order to get a successful outcome.
Absolutely. And would you say that it's okay in certain situations to maybe inject the tendon sheath or the fluid, rather than the actual tendon in some situations?
So that's one way to minimise potential complications of the actual injection. There's different techniques that we can use when it comes to injecting, and the luxury of technology now is that we do all our injections with ultrasound guidance, meaning that we use an ultrasound probe to actually visualise the internal structures, and we can actually position the needle to the millimetre where we want the injection and the medication to go.
Absolutely. Great, that's awesome.
Okay.
Yeah, that's great. And when would you specifically want to use PRP over cortisone?
Yeah, so again, it depends on the type of injuries that we deal with. So there's particular injuries that we would opt for PRP over cortisone. There's no general rule that we follow, and every relevant injury will have its own sort of treatment protocol that we use. For example, what we find now is tennis elbows. So what we find is that there's some new evidence emerging now that the cortisone and plasma are both good treatment options for tennis elbow, but the long-term effects of plasma use in tennis elbow is actually outperforming the cortisone group.
There you go.
So cortisone, in a very short summary, will usually have a faster effect, and it will help settle down treatments and pains quite quickly. But then what plasma is actually doing is it's a slower effect, but it has a longer term benefit.
Fantastic. No, that's great. And would you say that the plasma-rich platelet usually works a little bit better with tendons that are just struggling to settle down?
Correct, Versus, so we take everything into consideration. So someone who's got a fresh injury may not need plasma injections, so we would sometimes opt to just watch and wait and try more natural conservative treatments such as strength and conditioning and rehabilitation. But what we're finding is that those who experience long-term pain, especially with tendon-related injuries, not just acute injuries but also overuse injuries, they actually benefit quite well from the plasma. So it's something that's not used as a first-line treatment, but it's used in those resistant cases where recovery can be quite slow.
Yeah, very good, very good. All right. Well, Dr. Estee, thank you very much for your time. Really, really appreciate it, mate.
Pleasure's all mine.
And yeah, thank you so much for coming out. I feel like a lot of athletes and beyond, weekend warriors, people struggling with injuries will really benefit from this talk. So we really appreciate and value your time.
My pleasure.
Great.
Thanks.